gonna look through your hair and make sure everything looks okay. No itchy scalp or dandruff?
No.
Okay, very good. Okay, great. And I'm just gonna feel for any irregularities, any problems, anything like that. So, okay, I'm just gonna take a look at your face, make sure everything looks good, everything's symmetric and where it should be. So, okay, I'm just gonna palpate, feel your temporal artery here. Okay, all right, very good. Okay, take a look at your skin. Do you have tattoos anywhere?
No.
Okay. Look at your skin. Nails look nice. Okay. Take a look at your legs and your feet. Okay. Toenails are pretty color. Just going to look back here to see if there's any moles or any lesions or anything. Okay, very good. Anything on your upper chest area or your abdomen area in your skin?
No.
Any changes in the color of your skin? Any new moles or freckles or anything?
No.
No, okay, very good. So next what I'm going to do is I'm going to look at your TMJ. So what I want you to do is I want you to go ahead and open your mouth and close it. Good. Again, very good. Okay. And next, what I'm going to do is I'm going to palpate your sinuses. So please let me know if there's any tenderness. So I'm going to do your frontal sinuses first, and then your maxillary sinuses. No pain or tenderness? Okay, very good. Okay, I'm going to take a look at your eyes. So sclera looks good, conjunctiva is good. And check your lacrimal glands here. Very good. Okay, I'm going to grab my otoscope. And I'm going to turn this on. And so what I'm going to do next is I'm going to check your pupils. Okay, so I'm going to do a bunch of different tests just to make sure that they're okay. So just look straight ahead for me. Great. Okay, so I want you to look right here at the light. Okay, and then I just want you to follow it in. Okay, very good. All right, so next I'm going to check to see if you have good peripheral vision. Let me put my otoscope back. So what I'm going to do is I'm going to put my hands along the side, please. Okay, and then just tell me when you see my hands.
Here.
Okay, good, very good. Okay, and then I'm going to I want you to follow my finger. Okay, so without moving your head, just follow my finger. Okay, and I'm going to follow it towards you. Good, very good. Now I'm going to do your fundoscopic exam. So I'm going to look deep into your eyes. Okay, make sure there are no abnormalities. So if you can look straight ahead for me. Okay, very good. This side. Okay, very good. Let me go ahead and put this away. So this looked very nice. So, okay, the next thing I'm going to do is I'm going to do your ears, evaluate your ears. Okay, have you had any earaches, any drainage from your ears, any problems?
No.
Okay, great. Your earrings.
Thank you.
Okay, next thing I'm going to do is a whisper test. So I'm going to cover one of your ears and I want you to tell me what I say.
Softball. Lacrosse.
Okay, very good. All right. So the next thing I'm going to do is I'm going to grab my otoscope here. I'm going to take a look inside of your ears, okay? So I'm going to pull this up and back. And I'm going to take a look in. Okay, everything looks nice. Your tympanic membrane is nice and pearly white. Your bone, your structure of your bones look good. Okay, I'm gonna go to this side now. Okay. All right, everything looks great there too. Thank you. Okay. All right. So the next thing that I'm going to do is I'm going to take my tuning fork and I'm going to vibrate it. I want to make sure that your bone conduction is good. So I want you to tell me when you don't feel the vibration anymore.
No.
Okay. Can you let me know when you don't hear the vibration anymore?
No. No.
And when you hear it?
No.
Don't hear it? Okay. Great. So that was the Weber and the Rhine test. So what I'm going to do now is I'm going to go ahead and look at your nose. I will take a look up your nose to make sure that everything looks okay. All right. Any nasal drainage, post-nasal drip, anything? Okay. All right. Very nice. All right. Looks good. Next I'm going to do is your mouth. So go ahead and open your mouth for me. Say ah. Ah. Good. Very good. Okay. Go ahead and smile. Okay. Very good. All right. And then what I want to do is I want to go ahead and just look in your mouth a little bit more. I want to feel to make sure that I don't feel anything. You don't have any sores or open areas in your mouth? Okay. Go ahead and open your mouth again for me. Gums are nice and pink. Your teeth are beautiful. Let me see your tongue. Go ahead and stick your tongue out again. Okay. Go ahead and lift your tongue up for me so I can see underneath. Good. Very good. Everything looks normal there. Okay. The next thing I'm going to do is I'm going to go ahead and feel your lymph nodes. So there's multiple lymph nodes. The first thing I'm going to do is check with your occipital ones, which are back here behind the neck. And then I'm going to go to your postauricular, which are behind your ears, and then your preauricular, which are right in front of your ears. Then I'm going to do your tonsillar, then your submandibular, and then your there we go. And then I'm going to go ahead down to your anterior cervical chain. And then let me have you turn your neck for me so that I can, there we go. Okay, and your other side? Okay, there we go. Okay, and then I want to go ahead and check your supraclavicular and your infraclavicular. Okay, very good. All right, so the next thing I'm going to do is palpate your trachea. Do you have any problems swallowing?
No.
Okay. Any hoarseness in your voice?
No.
Okay, very good. Okay, I'm going to check your trachea or your thyroid. Go ahead and swallow for me. Okay, great. All right. Well, everything appears to be completely normal. That is the end of our assessment. Thank you so much.
Okay, and then we're going to start with your head.
Okay.
There's no facial drooping. Your eyes and ears and nose are proportionate. Your hair is nice and clean and put together. Okay, I'll just get you to look past my shoulder and I'll test your eyes. Okay, and then just follow the light. And also just get you open your mouth for me, please. You can raise your tongue up and down. And can you smile for me? Perfect, thank you. So your gums are pink, perfect.
Woo, that light!
There's no deviation in your mouth, there's no lesions, no nothing, and your pupils are equal and reacted to light. And they accommodate, which is perfect.
Beautiful.
Okay. Do you have any problems with your thyroid at all?
No?
Okay,
Anything about it?
perfect. Now I'll just test both your radial pulses, that's okay.
Yeah.
Just make sure they're equal. Perfect, they're equal. I'm just gonna feel your skin if that's okay. Do you ever have cold hands at all?
Yeah, I usually have.
Yeah,
cold
okay,
hands.
they're a little cold, but that's okay. Okay, I'm just gonna test your capillary refill. It's a little harder. Actually, I'll use down here because since you have nails, it's a little hard. Perfect. They refill under 3 seconds. Thank you. Do you tan at all?
In the summer, yeah.
Okay, and do you have any noticeable bumps or bruises that you're worried about?
No, nothing.
Okay, perfect. Okay, and now I'm just gonna listen to your lungs.
Okay.
I'll just get you to breathe in and breathe out through your mouth, please.
Okay.
Start just over the clavicle. To your heart, and listen to all 5 valves, and then I'll count your apical pulse for a full minute.
Okay.
Okay, starting with your aortic, I'll feel your sternal notch and move over mid-clavicular to your right. Perfect, and then I'll move mid-clavicular to the right to hear your pulmonic. And then down 1 intercostal space for your Herb's point. Then 1 more down for your tricuspid. And lastly, over to the right a little bit for your mitral. And I'll listen for 1 minute. Perfect. Your apical pulse was 80, which is perfect.
Perfect.
I'm just going to listen with my bell just to hear if I can hear any murmurs.
Okay.
Again, also our aortic. And the pulmonic. And herbs. And tricuspid. And lastly, your mitral. Sweet. Sounds good. No murmurs.
Perfect. Thank God.
Have you ever felt any palpitations at all?
No, nothing that I'm
Okay,
aware
sweet. Okay, now I'm gonna inspect your abdomen if that's okay.
Okay.
Sweet. I'll just get you to lift your shirt up a little bit, and I'm just gonna inspect first. I'll just get you to breathe normally like you would every day.
It's a lot harder when everyone's watching you.
Yeah, I feel that. Okay. I'm just going to listen to all 4 quadrants just to make sure your valves are good. First, your iliac valve. Perfect. Perfect. I'm also just going to listen to your aortic valve, or your aortic artery, and your renal artery when I'm here. Perfect. Okay, and lastly, I'm just going to percuss and then palpitate, okay?
Okay.
Okay, and I'm just going to palpitate. Let me know if there's any discomfort or pain.
Okay.
Headed to assessment, I'm going to listen to the back of your lungs and then also your lower extremities. So let's get you to turn around. That's okay.
Yeah.
And when you feel the bell or the diaphragm, my stethoscope, let's you breathe in through your mouth
Okay.
and out through your mouth. Perfect. Do you have any history of lung disease or lung cancer in your family?
No, nothing at all.
Okay, perfect. I'll get you to lay down for me.
Okay.
I'm just feeling for the warmth of your skin. Make sure it's the same. Perfect. I'm just going to test your capillary refill. Sweet. It's under 3 seconds. Your skin tuger. Then edema. Perfect. I'm just going to lift each foot up. Just check your heels, because that's very important. Perfect. And lastly, I'm just going to feel your pedal pulses, make sure they're the same. Perfect. Thank you for coming in today.
Inspecting the head for any lumps, lesions, hair pattern, distribution appears normal. Head looks normal cephalic, contour symmetrical. We're going to start to palpate the head now. With no scales, no lesions, hair is thick, no masses, symmetrical. We're going to start with the eyes. I'm going to assess a visual acuity with the Rosenbaum card. If you could please hold it 14 inches away from your face, cover one eye, and just read it from top to bottom.
A, B, C, D, E.
Perfect. We're going to do the same thing with this at 14 inches away, please. Go
A,
ahead.
B, C, D, E.
Okay, perfect. Acuity is 20. Perfect. Now we're going to inspect the eyes. Eyebrows and position of the eyes look symmetrical. Eyelashes look symmetrical, no ocular swelling. Size and shape is normal. I'm going to observe the medial and lateral candia, as well as the lacrimal ducts. Now I'm going to pull down the lower eyelids, assessing the conjunctiva. It looks nice and pink, looks healthy, no drainage, no redness. Now I'm going to lift up the upper eyelids to check for the sclera. Sclera looks nice and white. Cornea and iris look normal position and size. Everything looks symmetrical. Now we're going to start to inspect the pupils for direct and consensual papillary light reflex. I'm going to use a pen light. First thing I'm going to do is I'm going to dim the room. I'm going to have you look straight ahead at me. I'm going to move the pen light. Look straight at me, please. I'm going to move the pen into one eye, and it should constrict your eye, and this eye should constrict as well. So try it again. Perfect. And then when I move it away, it should dilate. I'm going to do the other. Move it away, it should dilate. Perfect. Now we're going to do the accommodation test. Let's focus on the pen. As I move it forward, your pupil should constrict. As I move farther away, they should dilate. Perfect. Now we're going to do the confrontation test, which checks for peripheral vision. So you're going to cover the opposite eyes. You're going to cover your right eye. I'm going to cover my left eye. And what I'm going to do is I'm going to just move my fingers, and you tell me when you see them, okay?
Yes.
Perfect.
Yes.
Okay.
Yes.
Great. I'm going to do the other side, okay? Perfect. Ready?
Yes.
Okay.
Yes.
Okay.
Yes.
Perfect. Now we're going to check for extraocular movement. Please follow my pen light in all 6 positions. Ready? Good. Only your eyes. Keep your head straight. Perfect. We're checking for nystagmus and parallel movement of the eyes. Perfect. Now we're going to take you to ophthalmoscope for the eye exam. I'm going to check for the red light reflex, which is a normal finding. Perfect. The light is placed into the pupil. I see the optic disc. It's nice and orange. I see the blood vessels that are leading right to it. Check the other eye now. Perfect. Alright, now we're going to move on to the nose. Nose looks symmetrical. Midline. Perfect. I'm going to palpate for tenderness. I'm going to palpate the maxillary and frontal sinuses. Okay. No tenderness noted. Now we're going to use the speculum to see inside of your nasal septum. I'm going to just press the tip of your nose up gently to take a look. No obstruction noted. Fine hairs are visible. Looks pink, looks moist. No discharge. No mucus. No deviation or swelling. Perfect. Now we're going to move on to the mouth. We're going to inspect the lips for swelling. The color looks nice and pink. There's no dryness. It doesn't look cyanotic. No lesions. Please open your mouth. Thank you so much. No dental caries. Gums look healthy, pink. Buccal mucosa and looks nice and pink and soft and moist. Would you mind just saying ah for me, please? I'm going to inspect the tonsils. Tonsils look normal. No redness. No inflammation. The uvula is rising. Their tongue looks pink and moist. No white streaks noted. Would you mind lifting up your tongue? I'll check underneath it. Perfect. Looks healthy. Can you and side to side? And I'm just gonna look at your soft and hard palate. They look nice and clear, nice and healthy. Perfect. Now we're gonna move on to the ear. We're gonna inspect for symmetry. Shape and size appear normal. No lesions, lumps, or swelling noted. We're going to palpate the mastoid proper. Do you feel any tenderness?
No.
Okay, perfect. Now we're going to pull the auricle up and back. I'm going to insert the speculum. No erythema, drainage, or masses or lesions noted. No cerumen. I see the cone of light. It's nice and shiny. I see the medium malleus. It looks gray, as well as the paraflaccida. Check the other side. No perforation or scoring noted. Okay, now we're going to check your gross hearing. I'm going to rub my fingers together 4 inches away from your ear. Would you mind just covering the non-testing ear? You'll cover this ear. Tell me when you hear it.
Yes.
Perfect. We're going to do the other ear now.
Yes.
Perfect. 4 inches away. Perfect. Okay. Now we're going to do the Weber test. I'm going to bang the tuning fork and place it right in over here. You should feel the vibration equally.
I feel.
Perfect. If it's bilateral in both ears, that's healthy, normal finding. Now what we're going to do is we're going to do the rind test. I'm going to bang the tuning fork, place it in the back of the bone. Let me know when you stop feeling the vibration. You stop. Okay, do you hear the air conduction?
Mm-hmm.
Okay, on the other side. Yes?
Yes.
Okay, we're checking, basically the air conduction is greater than bone conduction, which is a normal finding. Perfect. Now we're going to move on to the neck. We're going to check for symmetry. Trachea appears midline, no deviation, no masses noted. I'm going to palpate the lymph nodes, starting with the periauricular, postauricular, occipital, then we have tonsillar, submandibular, submental, superficial cervical chain, deep cervical chain, posterior cervical chain, and the supraclavicular nose. Now we're going to palpate the thyroid from a posterior approach. So we're just going to tilt you over here. Tilt your head back, please. Place my fingers around your neck. Please swallow for me. Perfect. This side. Perfect. No deviation, no enlargement, no. Now we're going to move on to the chest. We're going to drape the patient for privacy. Have the patient sitting upright. We're going to start off with the back, with the posterior. I'm estimating the diameter, AP to lateral chest diameter. It's approximately 16 millimeters. We're going to inspect the posterior chest. No skin abnormalities, no lesions. no bumps. Respiration rate looks normal, no retractions, no bruising, no shortness of breath noted. It looks like a normal breathing pattern. Okay, now we're gonna palpate for any masses, no tenderness. Now we'll assess for chest expansion by taking my hands, placing it underneath at the bottom of the rib cage, like this. And I'm watching for symmetrical expansion while the patient's taking a deep breath. Perfect. Okay, now we'll check for tactile firmitis. I'm gonna press the palm of my hand right by the lobe. Could you mind please saying 99?
99, 99, 99,
Perfect.
99, 99.
I'm feeling
99.
equal vibration, which is a normal finding. Now I'm gonna percuss. All right. I'm gonna be using the leash. Okay, let's go. Percuss. Checking for resonance. Next is the diaphragmatic excursion. I'm going to ask you to please exhale. Exhale, please, and hold your breath. Thank you. I'm just going to percuss until I hear dullness, and that's with my point where I'm going to mark it. Now I'm going to ask you to please take a deep breath in, and I'm going to percuss. I'm going to percuss until I hear dullness, and I mark it right here. And the difference should be between 3 to 5 centimeters. Now, I will auscultate your lungs. Please take a deep breath in and out, okay? Perfect.